It's Mari McInerney here, and we're at the Sharing Minds Forum in Melbourne, and I'm going to get my two people here to introduce themselves. Anwar, could you introduce yourself first, please?
I'm Anwar. I'm from Springvale Community. I'm from Myanmar, Rohingya, and I came to Australia in 2013, and I went to a language school to improve my language. Went to language school for 6 to 7 months, and then I moved to high school. I finished high school now last year, and I applied for the job. I've got the job now, so I'm playing soccer for my community as well, and I'm doing soccer coaching for my community.
You want to put in a plug for the club? What's the club called?
The club's called Rohingyan Soccer Club.
Yeah.
Rohingya, Australian Rohingya Soccer Club.
Fantastic. Now, I will come back and speak to you, but you've been involved in this project that Belinda's going to tell us about now, because we've been at the forum. It's about mental health for issues. A lot of issues have come up for asylum seekers and refugees and other migrant communities.
Yeah, that's right, and a lot of those have been covered at the forum today. So at Link Health and Community, we're working with the Rohingya community and consulting to understand what their health needs are, and looking at some of the gaps. And the Rohingya community is sort of relatively new to us, so we're taking quite a bit of time to get to know them, and we'll continue working so that we can understand how Rohingya people view mental health and mental ill health and emotional well-being. So there's quite a few gaps in terms of the system. And
so what are you finding in terms of understandings about mental health that we need to consider when we're talking about Rohingya people, or for them, but also the gaps in the services available to them?
Well, we haven't approached mental health directly with the community. We don't want to make any assumptions around understandings of mental health or force any understandings upon them. So we're approaching things from a symptom perspective. So understanding symptoms and managing symptoms and getting help for general health issues and access to and supporting access to the system and general health literacy.
And so what can you give an example of something where there's been a breakthrough on that?
A breakthrough. I guess we're really just starting. We've been consulting a lot, so we've just started on the delivery of the project. We had a session on Saturday night with the community, and some volunteer GPs came along, and they really encouraged the community to set up relationships with their family doctor so that they could do preventative health checks, and then that way that's seen as a positive relationship, so that people can have the symptoms identified early in the piece.
Great. Anwar, can I come back to you and say the issues for you that you feel in the community? Where do you find that the support is needed?
Well, for study most of the time, I get support from my community, but I didn't afford to pay for my course, so they have actually helped me out. That's how that's the most important one, I would say. But in the future, if my country refugee people need support, for something like that. So that's how my community is important for me.
And you're well connected, aren't you?
Yes.
Can you talk about the cafe that you're involved in?
Well, the cafe, every weekend I go there. Even after I finish school now, I go there, hang out. I feel good around there because there's my culture people, my culture food. The people there is very nice. The owner of the shop is really nice. Even the food is beautiful, That's how that's about it. If I have spare time, I just go there, chill with my mates, and then there's pool table and all that. We can enjoy ourselves over there. That's pretty much.
Great. Belinda, what about mainstream services? Where do you see the gaps in really the way the whole system is set up?
Well, I mean, there are quite a few gaps, particularly when with mainstream services, and like Anwar mentioned with education, a lot of people can't access education. They need to pay sort of international student fees, which makes it really difficult for people to make any progress and take advantage of opportunities and access employment. with mainstream services, if people don't have a Medicare card, they can't see a GP. There are some health services like general hospitals that people go to, but also we know that hospitals really need to see urgent cases, so it's a very difficult balance of hospitals meeting the demand of urgent cases, and also
that was a point made by somebody from the department here that in Victoria the public hospitals do still provide medical services, but that underlined the fact that the loss of settlement services. What's the name of the
status resolution settlement support services? So a lot of asylum seekers who were on a income from Centrelink, which was 89% of a regular Centrelink allowance, which we all know is around the poverty line. So these people have less income, and now they've just lost that, and so these people may not have had sufficient access to English language classes for whatever reason. Sometimes they're parents and carers, sometimes they have mental health issues or physical health issues. The refugee experience means that often people have trauma from living in a persecuted minority. Then there's the trauma from the transition, the refugee journey from their home country through transition countries and then to Australia, often by boat, not always. And then in Australia, living in a precarious situation where they don't have access to stable housing, income, health support, and social connections. It's really important because often, as we've spoken about today, people come from villages where social connection is key and really important, and that's such a protective factor for mental health.
Anwar, before you freeze, what's your takeaway from today? What's been interesting for you to be at a forum like this?
Well, about today's program, I've learned many things. Also, I've met the different culture people here, and I've learned different ideas from the different communities, the different people. They have the different opinions. I mean, like I didn't knew I would learn this much from this program today. Well, I'm happy that I'll learn something out of it. Yeah.
Fantastic. All the best with your new job.
Thank you so much.
Thank you. Thanks, Belinda, too.